A typical drowning condition is very little or inhalation of water or fluid in the air passes. Dry drowning. Water does not enter the lung due to laryngeal spasm induced by a small amount of water entering the larynx, seen in 1 to 2% of cases. Death may be extremely rapid and time elapsed in insufficient for typical drowning to occur. Two mechanisms have been postulated. Reflex cardiac arrest due to vagal stimulation. Laryngeal spasm and airway closure causing lethal hypoxemia. In this case, autopsy findings and test of drowning are negative and lung fields are drier. Immersion syndrome, hydrofusion, submersion inhibition, and cold water drowning refers to syncope resulting from cardiac dysarrhythmia on sudden contact with the water at least 5 degrees Celsius lower than the body temperature. The syndrome is a result of cold water stimulating the nerve endings of the surface of the body. Water strikes in the epigastrium. Cold water entering the eardrum, nasal passages, pharynx and larynx, falling or driving into water with feet first or duck diving by the inexperienced. Mechanism: vagal stimulation leading to asystole cardiac arrest, diving reflex or ventricular fibrillation secondary to QT prolongation after a massive release of catecholamine on contact with the cold water. The resultant loss of consciousness lead to secondary drowning. The findings of typical drowning are absent. Diagnosis of hydrofusion is difficult because aspiration of water into the lungs does not occur. The syndrome particularly affects the middle-aged or elderly men who have ingested some amount of ethanol. Underlying cardiac disease could increase the risk of sudden collapse. Near drowning. Post-immersion syndrome, secondary drowning. Near drowning refers to a survival period 24 hours after a submersion episode. Death is caused by complication or sequelae of ARDS, pneumonia, sepsis, hypoxic ischemic encephalopathy, cerebral edema, disseminated intravascular coagulation. Secondary drowning sometimes refers to a victim who initially respond well to resuscitation but then suffers a respiratory decompensation. Shallow water drowning, submersion of the unconscious. Alcoholics, drug, epileptic, infant, children, unconscious person may die due to drowning in shallow water in a pit or drain. And cause of death in asphyxia, most common cause of death, freshwater drowning, result from VF, ventricular fibrillation in freshwater. Salt water, cardiac arrest in salt water from permanent pulmonary edema and associated changes. Vagal inhibition due to impact with water, laryngeal spasm, concussion and head injury. Apoplexy, subarachnoid hemorrhage from rupture of berry aneurysm or cerebral hemorrhage by rupture of the cerebral vessels from a sudden onrush of blood to the brain due to excitement or sudden fall from height into the cold water. Secondary causes septic aspiration pneumonia, sudden bursting of aneurysm. Apart from symptoms, apart from recalling of the memories of past events, there will be mental confusion along with auditory and visual hallucination, tinnitus and vertigo. Treatment and first and immediate step consists of application of artificial respiration with a closed chest, decompression, even in the absence of personal respiration. Strain during coronary. Defibrillator must be used when there is ventricular fibrillation. Freshwater drowning 4 to 5 minutes. Seawater drowning 8 to 12 minutes. Thank you.